First of all, though, our top story this morning, it's a disease that has the potential to have a huge impact on your life, and you can catch it doing something as simple as walking the dog. A Worcestershire mum who ended up with Lyme disease is calling for the NHS to recognise it as a chronic illness, and she says that she's struggling to even look after her own kids now after battling devastating symptoms for 14 months. Tracy Winchester, who's 41, is from Bromsgrove and was diagnosed with Lyme disease in March last year. And because the NHS doesn't offer any long-term treatment beyond 6 weeks of antibiotics, Tracy and her husband, Russ, are struggling to cope. And all this started after she was bitten by an infected tick. Our reporter, Tom Edwards, has been along to meet them.
Who's doing your bedtimes tonight? Who's doing who? I think I'm Maeve tonight.
When did you realise that something wasn't quite right?
I had a rash appear. That was the first sign of anything. And so I ended up going to see an online GP who then confirmed it was the typical bullseye rash that you associate with Lyme disease.
So at the very start, I guess you would have hoped that you would have recovered pretty quickly.
Yeah, I thought I should be okay. I've caught it early, should be okay. But little did I know, I guess, until I started reading up a bit more on it, that often that's not the case. And sadly, that seems to be the same for me. So,
give me an idea of how it affects your day-to-day life.
The unpredictability is probably the worst thing. First thing in the morning, I suppose, though, without fail, the fatigue really, really hits me hard. I used to be quite a sprightly kind of morning person. Now I can't really get myself out of bed. And there are some days, I guess, which are a total write-off. I get joint pains, I get sort of like burning feelings in my pelvis. The bad days are the ones where I don't really get through it. I guess it's just, I just can't really get myself out of bed, literally just have nothing in me, no energy to do really anything.
It's really quite a helpless situation that you find yourself in. What we didn't know at the time was the huge impact that little bite was going to potentially have on our lives, and is still having on our lives even today.
And alongside everything else with the kids and things, like I say, they need a lot of support, and I feel like I can't give that.
Right, let me give you a push, Maeve.
Yeah.
Hey, that's good. You enjoying that, Maeve?
Okay, so this goes back to when? The 26th of April. What we got here? Fatigue, migraines, sore eyes, breathing issues.
Yeah, I started doing this just because it is so varied every day, as you can see.
This diary's packed full of entrances, isn't it?
The fatigue is the one that's every day.
Do you feel as though the NHS have offered you enough support?
No, not at all. They just don't have the knowledge, they don't have the resources, that kind of attitude of, we've had the antibiotics, so you should be better. And I think much like long COVID, we've got a lot to learn about chronic Lyme disease and how it's affecting people. And I think there's probably a lot of people out there that don't even realise that they're suffering with it, but they are.
You must be concerned that this situation has already gone on now for 13 months.
Yeah, absolutely. It's been going on for, it feels like forever, and with no real hope. We have some very dark moments of really not seeing an end to it all. I think it's shocking, frankly, because there seems to be a huge lack of knowledge in the NHS about this. Unfortunately, it's just a lot of people suffering in silence. It can't be fair that people have symptoms and are suffering, but the door just gets closed in people's faces. I just think that's completely unjust.
So reporter Tom Edwards with Tracy Winchester and her husband Ross in Bromsgrove. Now, there's been quite a lot around this. I mean, a lot of celebrities have actually spoken out about this with their long-term battles. Justin Bieber, Avril Lavigne, the actor Ben Stiller, Shania Twain had this, also Kelly Osbourne as well. And in 2013, a big group of protesters marched on Downing Street calling for the NHS to recognise Lyme disease as a chronic condition that needs long-term treatment. Let's talk to Rosie Milsom, who's from the Lyme disease charity Caldwell Lyme Co. Good morning, Rosie.
Good morning.
So how many people do you think get diagnosed with this a year? Do you know?
Well, it's such a tricky thing that the official figures are 2,000 to 3,000. That's from Public Health England, but that's largely based on laboratory testing. And not everybody gets diagnosed that way. There was a study done in 2019 of GP medical records between 2001 and 2012, which found that cases increased tenfold within that time, and that if the rate of increase had continued, the number of cases diagnosed in 2019 would have been about 9,000 to 10,000. But the true figure is unknown because there isn't a 100% accurate test available on the NHS. There's about at least 1 in 5 people come back with a potential false negative. So until we get an accurate test and as we heard there, more kind of experience and knowledge from the medical profession, it's difficult to put a real number on it.
And how do most people catch it? Is it as simple as walking the dog and being bitten by a tick, that kind of thing?
Yeah, it can be. I think there is a thought that, you have to be out in the kind of Highlands or the New Forest or out in long grass. But we speak to many people that get bitten even in their back garden. They live mostly in long grass, forests, woods. But, people like Matt Dawson, the rugby player, he got bit in Richmond Park, so anywhere where there are animals, anywhere outside, you are potentially at risk. But yes, stuff like dog walking or camping, working with animals, you're probably going to be an elevated risk.
I know we were talking to a doctor early on who was saying that there's a sort of 24-hour window. If you find the tick there and you can remove it, you're okay. How big are these ticks? Are they easy to miss?
It's so easy to miss. Ticks can be as tiny as a poppy seed and grow as big as a baked bean when they've had a feed. But you can easily mistake them for, a speck of dirt, which is why you have to look really, really carefully for them after spending time outside. Checking places like, your armpit, belly button. They like to kind of, crawl and hide in places. Yeah, I know it's a little bit gross. But the 24-hour thing, I just want to touch on that briefly. There hasn't really been enough research into that to kind of absolutely say that's a definite transmission thing. We always say move a tick as soon as you can, because obviously the less time it's attached, the less chance it will have to transmit the disease. But if they are so tiny, you might not actually know how long it's been attached. So we wouldn't want to give anyone like a false impression. It's about checking when you've been outside, walking the dog, camping, spending time outside, working outside, removing one as soon as you find it, and keeping an eye out for symptoms.
So, I suppose if it's that easy to miss one, there could be quite a lot of people who have got symptoms that, they've never discovered this, and they could have Lyme disease.
Yeah, that's another reason why cases could be a lot higher than we realise, because the symptoms are similar to so many other illnesses. Arthritis. We speak to a lot of people that are diagnosed with chronic fatigue syndrome, fibromyalgia. There's even people have been misdiagnosed with things like MS and Parkinson's because, let's say, the symptoms have such a crossover, especially once they become chronic. It is possible that there are people that don't even know that they have it.
What do you want to happen then, Rosie? What would be the ideal?
Well, what we're trying to do as a charity is fund research into Lyme disease that finds a more accurate test, because at the moment the test is antibody-based, so all it can tell you can't test someone for cure, and it's sometimes flawed in picking up the infection in the first place. So we need a test that can accurately detect the infection and that you can test somebody after treatment, so someone like Tracy, to tell whether or not they're cured for sure, which you can't do at the moment, and also find treatment protocols that work for every patient at every stage of the disease. Tracy was really unlucky that she caught it early, got the standard treatment and didn't recover. Hopefully she got all of the treatment she was entitled to. But if you are delayed in diagnosis, that antibiotic course on the NHS doesn't cure everybody. And so we're trying to find that and therefore through that research further educate and work with the medical profession to increase knowledge around GP so they can spot it early, get people treated and have a bit more understanding about this, long-term illness.
Rosie, really good to speak to you. Thanks for having a chat with us this morning. Rosie Milsom, who's from the Lyme Disease charity Caldwell Lyme Co. We've got a statement from NICE, the National Institute for Clinical Excellence. They say some symptoms of Lyme disease may take months or years to recover from, but their current guidelines don't recommend the routine use of ongoing antibiotics. Or as Rosie was saying, you get a sort of 6 weeks course of it, and for many people, in fairness, that does nail it. But what about this sort of 5% or so, which is a good few thousand people a year who end up with this lingering chronic, and in many cases you've been hearing, life altering condition. It's not great, is it? Give us your thoughts on this. If you've had anything similar happen, then do please give us your story, please, if you've been affected by it. 0800 121 8181, text 81333, start with HW.
Feel good box sets on BBC iPlayer. From Top Gear